Some people think COVID-19 doesn't exist or SARS-CoV-2 doesn't exist. And I was just reading an analysis from Australia that opined along those lines. And I tend to disagree. I think it's real. And for the following reasons, is both the Chinese as well as labs in the United States sequence the virus. We can identify the virus in individuals. It's not influenza, it's the virus. It's SARS-CoV-2. Its entire genetic code is known. And so it can be fully sequenced. Of interest, it's sequenced in the GI tract. It's very difficult to sequence it completely out of the nasopharyngeal tract. And so the best we can do is maybe pick up a few sequences of the nucleocapsid from the nares. Otherwise, it's all about the GI tract. So in the United States, we rely on a lab in California headed up by Dr. Sabine Hazen that's clearly demonstrated the virus is there. And we knew early on that there was a blend of variants of the virus in every population. The other major difference between influenza and COVID-19 is that influenza itself is rarely the immediate problem that leads to severe illness and hospitalization. It's almost always a bacterial secondary pneumonia. In fact, a staphylococcal pneumonia is most common. So in my practice, I remember in 2018, 2019, we had some serious patients at my hospital that I was rounding on, and they had influenza, but the real problem was a secondary staphylococcal pneumonia. With COVID-19, it's quite interesting. There is a low rate of any secondary bacterial infections. It's almost COVID all the way. And instead of a secondary bacterial infection, COVID-19 does something very different than the flu, is it creates cytokine storm or an abnormal immune system activation, and then devastating thrombosis, microthrombosis and macrothrombosis. And we don't see that in influenza. So I'm pretty convinced they're two separate illnesses.